football match tonight?
So at the moment, everyone will be wearing a mask and will be sitting down in a socially distanced way. I'm still toying with the notion of what we're going to do to vary it. So it's the same protocol as we've had with the boxing match. This is an outdoor arena. As I've said, it would have been better to do the outdoor before the indoor, but it is what it is. So in the outdoor arena, we're going to have over 600 people will be sitting there, chosen at random, who will be vaccinated, will have shown an ID card, will have a same-day lateral flow test, sitting in a socially distanced way.
Why have people use masks at the match when masks are no longer required outdoors in Gibraltar?
So of course we dreamt up the protocol about a month ago, so at that point it was different and it was difficult to know what would happen. And remember, what I'm trying to do is work out transmission rates. And in the transmission rates, each experiment that we're carrying is going to be slightly different from the other.
These events have given you the opportunity to swab around 500 members of the community on each occasion at one go. So what has it told you about the prevalence of the virus in our community?
Well, we haven't had any positives from the boxing. I don't know yet. I don't know yet from the football because I haven't had the reports back on it. But I'm assuming that we've got very low levels of transmission of the virus, which is a good thing. But to think that that means then all of a sudden we're never going to have the virus come back, well, clearly it's obvious that we have got positive cases at the moment in Gib. And I say latterly, everyone has been something that has been imported from outside, and we do not have the luxury of shutting our frontier.
Do you anticipate an increase in cases following these two events?
Yeah, I wish I had a crystal ball. I hope I don't. I really hope I don't. But it really depends on the things that I couldn't see, which were things that were perhaps happening in the community, out in the community, the things that everyone had agreed that they wouldn't do, which is mix. It's very hard to control those things. That's one of the things we've learnt about this virus. It finds you out. So I hope we don't have the rise. And within that context, of course, is a rising number of cases throughout Europe at the moment. They are going to experience a surge, and I hope that we avoid that. And certainly with a double vaccinated population, we're about as secure as we can be.
You wouldn't be able to tell us how many have rejected the vaccine when being offered it?
I think it's difficult for me to say the exact number.
Any idea?
I think we're looking at possibly 1 in 10, possibly. Okay. It could be as many as that. It could be a little bit less. It could be a little bit more.